Safe sex, as the name suggests, involves some kind of a barrier, whether it's the external male condom or the internal female condom, or whether it's the use of a dental dam. It's some kind of barrier to prevent the exchange of bodily fluids. What this does is it helps to prevent the transmission of sexually transmitted infections or diseases. And of course, safer sex helps with preventing pregnancy. So when we talk about a barrier, it's not just about contraception. For instance, like people can go on contraception, be on the female hormonal pill. Um, that is to prevent pregnancy. But with safer sex, we are talking about some kind of a barrier to prevent the transmission of sexually transmitted infections. A lot of people use the term safe sex, but actually, to be more accurate, it should be called safer sex, because there's nothing that's completely 100% safe. So, a more accurate term is to use safer sex instead. So, when we say safer sex, we're actually talking about the same thing, but we're just becoming a little bit clearer in the sense that it's not 100% safe. Queer people have sex pretty much the same way that every any other person has sex. It's just that people who are queer, they may be attracted to somebody who is of the same gender. We're talking about people who identify as gay, lesbian, bisexual. They might be sexual with someone of the same gender, or they might be with somebody who is born in a different body than their biological sex. So maybe transgender, a person who identifies as transgender, or like a person who doesn't identify as any gender, like a non-binary. So the whole spectrum of queer, it just means people who are attracted to people who is not of the same gender. So people who are not heterosexuals, essentially. So having defined what is queer, queer people pretty much have sex the same way. They use fingers, hands, hand job, blow job, oral sex, cunnilingus, fellatio. They do engage in penetration, whether it's into the vagina or the anus. So the possibilities are infinite. Ultimately, sex is about pleasure, and it's about feeling the connection, it's about the union, it's about feeling good and having fun. So there's no right and wrong way for anybody to have sex. I do have people asking me, oh, how do gay people have sex? How do lesbian people have sex? I think it's really about just having fun. I don't think we should have a separate conversation on safer sex for queer people. I think this should be a conversation that includes everybody, and it is important for all genders, all sexual orientations, all uh, races, nationalities, all humans. I think it's important for everybody to be talking about it. But I think when we position it as a safer sex for queer people, we are keeping in mind that for them, because they are more likely to engage in anal sex, so one of the things to look out for is that the anus, unlike the vagina, doesn't expand, doesn't grow when aroused. So what happens is the vagina does expand and grow when the person with the vagina is aroused. So what this does, it then allows for the vagina to be less likely to have micro tears, which can increase the chances of sexually transmitted infection. Of course, the exchange of bodily fluids, the exposure to the internal mucous membrane can, of course, also lead to sexually transmitted infections. But the micro tears actually really increases the chances. So micro tears can happen when there's dryness. So when it comes to the anus, having sex in the anus, it's more likely to happen that tears can happen, and it's more increases the chances because of the nature of how the anus is. It can increase the chance of sexually transmitted infections. So it's really important to be talking about the use of the male condom. Is very important to be talking about the use of lubrication, the importance of foreplay, anal massage, relaxation. All these things can help prevent pain during sex, and tearing or bleeding or cuts, things like that. So it's really important to talk about safer sex, because I think when it comes to anal play, for instance, we don't really talk about it. It's considered like so taboo, sinful, dirty, unhygienic, and things like that. But the reality is, you can take care of yourself by maintaining your sexual health, by engaging in safer sex practices. It's a form of expression, and everybody should be entitled to expressing their sexuality in a way that feels good and feels safe for them. So one of the things that happens is that, unfortunately, in our society, we are still very very long from creating a space that is safe for our queer friends. And so what happens is some of them are in the closet, and they do not know who to talk to when it comes to safer sex negotiation and communication. So if you are not able to learn how to speak up for yourself, to make sure that you are every engaged in safer sex every single time, and it needs to be every single time, then of course there will always be this worry, like, am I truly like safe from STI or HIV? So it's really important to understand that, regardless of your sexual orientation, gender identity, you have a right to be safe, and you need to be able to have these conversations around the need to have safer sex. If the person doesn't have a condom, then you're not going to have sex. You're just going to engage in other sexual activities, for instance, like cuddling, and instead, rather than, or hand job instead, rather than engaging in penetration without condom, for instance. So safer sex is very important, and I think people who have a low self-esteem, people who are in the closet, people who haven't had a lot of modeling or sex education around communication around safer sex, are more likely and more vulnerable to be abused and taken advantage of. There are also cases of stealthing. So stealthing is a practice where they are wearing the condom when they have sex, start having sex, and then they take off the condom in the middle of sex. So this is, to me, rape. It is so terrible, but this does happen because there are people who can take advantage of you. So it's really important to ensure that the partner that you are with, you actually know this person, you have had a conversation around safer sex practices, that you feel comfortable to expose yourself in this way to someone. And however, in life, of course, we take risks. So for queer people who do engage frequently in anal sex, and also frequently in casual sex, you may want to think about being on PrEP, for instance. So PrEP is a medication that helps to reduce the chances of catching HIV, because there are many sexually transmitted infections that one can get, but at the moment, HIV is the one that doesn't have a cure. So is human papilloma virus, and so is herpes. But those are not life threatening. Whereas for HIV, one who is on HIV, they need to be on medication to and to ensure that their antiviral load is low, and so it can be very costly, right, once you catch HIV. So being able to explore other things, like for instance PrEP, is one of the things that you may want to look into in your city. You may want to talk to your doctor. You may want to go to a sexual health clinic to find out more about this. If you are engaged in casual sex, it's really important to go for regular testing and to engage in safer sex practices every single time.